Thank you very much, Olga. That saved me the first few minutes of introducing myself to you all. And after that inspiring talk there, I'm not sure I really want to get up and talk, but I'll do my best. I too have CLL. It first came to my notice about 4.5 years ago, and as is my wont, I was stood on the second tee of our golf course, which is slightly elevated. And I said to my friends who I played with very regularly in those days, at least 3 times a week, I said, God, I feel unfit. I said, you know, we've been playing golf 3 times a week for the last year. When the summer comes, we need to get out more. You know, this is my answer to this. Had no idea whatsoever. And then about a week later, I went down with, strangely of all things, a breast abscess, which at my age, you know, that's what mums get when they're breastfeeding, not when you get to retirement age. So I had a breast abscess, which took a while to clear up, and blood tests afterwards, and more blood tests afterwards, and more blood tests afterwards, and people began to get a bit excited. And so I was sent off to hospital to see the haematologist. This was in my local hospital, which I won't tell you where I live because I don't have a good word to say about my local hospital. Anyway, I tipped up for my first appointment. Very nice consultant who went through everything and said, this is what's wrong with you, and you need to start treatment now. Which one has to understand, mine is a second marriage, and my husband's first wife died of breast cancer. So to be confronted with your second wife sitting there with somebody saying to you she needs to start chemotherapy right now, sort of thing, she's all these signs and symptoms. So it was a bit of a shock, to put it politely. So I'm trying to prop him up whilst overcoming this slight concern of mine, which was fine. We came out from the consultant's office arranging to go back 2 weeks later, having had more blood tests, and I bumped into the Macmillan Cancer Service was sat beside me, and he'd gone off to the gentleman's room. So I thought, oh, I'll just pick some information up. And bear in mind, I am a retired director of nursing, so I'm pretty old and bold and all the rest of it, and things don't tend to upset me. As I turned into this Macmillan stand, and the Macmillan nurse was there, and she said to me, oh, you've just been diagnosed with cancer. Now, I could cope with the leukemia, and I could cope with everything else, but to be fronted up with, you've got cancer. And I don't know whether anybody else has experienced this, but actually, that hurt. You know, that really did. And I'm still thinking, got to keep this away from the husband. He can't cope with this. I have to keep this inside. So it was all a bit fraught. Anyway, I rolled on from there, and we went to the next appointment. Same consultant, sat down, she went through everything again, and she said, oh, well, I'll see you again in 6 months' time. So I thought, hang on a minute, just a minute. 3 weeks ago, you're telling me I need treatment. I've just got my head around this. Now you're telling me you'll see me in 6 months' time. So I kind of asked a few questions, and we looked at each other, and we got outside, and I said to my husband, did I misunderstand my first appointment? And he said, no. I said, she's lost my notes. So I got home. As I say, I know how to work the system. So I get home, I immediately phone her secretary, and I say, look, I've just had this really unfortunate experience. Have my notes been lost? And the secretary says, well, I don't know, I'll speak to her. Anyway, she came on the phone herself and was on the phone for nearly an hour and explained to me that my bloods had come back and they hadn't been as severe as she thought they were, and removing all the rest of it, and I didn't need treatment, and so on and so forth, which was fine. So my first learning curve was then to say, can I have a copy of my notes? So if you want to learn anything from this, and I've tried to pull out a few learning points, it's you would be well advised to keep results of your blood tests, and if you want your records, you only have to ask. You can have your NHS records. They are yours. They may charge you an admin fee of about £10, but if you ask at the hospital, you can have a copy of all your test results and all your notes. And speaking from experience, I'd kind of suggest you do. So that was that. So that was my first. So I then still wasn't particularly happy, and I saw a different consultant the next time I went, who went, there, dear, you're all right, you'll be fine, which kind of, you know, doesn't exactly make you feel good. So I then found the CLL Support Association online and quickly did some research, and there was one of these patient conferences coming up at Bart's. And like somebody else I know here today, I immediately collared the consultant afterwards and I said, look, this is my quick story, this is what's happened. He said, no problem, Pauline, you're a woman, you're young, he's been my friend ever since. I will see you in London, no problem at all. So he took me on as a patient and I have been a patient of Samir's ever since. The cost of this was this gentleman here who then made me become a trustee at the same meeting and also made me do this, which is the first time I've done it in 5 years, Nick, thank you. And so I spoke at that. So I think that there is one other, I made a little list and I'll do them very quickly because I know it's the end of the day, of things that I think are important. The first of which, have your records, keep your blood tests. The second is, in all this workup, I had to have a bone marrow biopsy. Now, I know some of you here will have had them and will have had different experiences. I don't have a good word to say about my local hospital, except that I had to have a bone marrow biopsy. All my nursey friends went, ooh, wouldn't do that. You have to give me a general anaesthetic to have one of those, which doesn't do you a lot of good when you've got to go and have one. I tipped up at the local hospital, and we have a clinical nurse specialist there who does nothing but bone marrow biopsies. She works with a healthcare assistant, and she was fantastic, folks. It's the one thing I'd recommend that you go to that hospital for. She did my bone marrow biopsy. It was less traumatic and painful than going to the dentist. Now, that's my experience, and that's one you should hang on to, because if you ever need one done, stay calm. It's not that bad, okay? So that's my second learning point. Silly things which you all know about writing down questions for your appointments so that you make sure taking somebody with you who can listen to those. And, you know, as for support, my husband's lurking in the background now, do him a mischief if he comes in. His support to me today was to go and look at Oxford, which he frequently does. He's looked at Leicester, he's looked at Liverpool, he's looked at Cambridge, you name it, he's been there. He's a great support. He is really, but he's lovely. So that's him. I also have 10 grandchildren who try and wear me out most of the time and succeed. So everybody just expects that I can do what I've always done. The fact that we now have introduced in our family a quiet time after lunch. When the grandchildren are there, TV goes on and grandma goes to bed for an hour. That way I cope really well. They are the love of my life. They really are. And they're, you know, keep me going all the time. So that's a very quick scoop through, because I know it's pouring with rain and everybody wants to go home. Just, you know, it's really what was said before. Enjoy every day. Enjoy life and enjoy the family, whatever it is that you want to do, to travel or whatever, because, you know, none of us know what the next blood test is going to reveal. But that's me, and good luck.